Hello, everybody. I think we are set and ready to start the last session. There's two things that we will discuss here. We'll just have a brief recap of the breakout rooms so that everybody who's participated in a different group, as well as those online, are aware what has happened in the other groups. Keeping in mind that we will be sending a recording of all of the rooms and all of the sessions to you afterwards as well. But it's just good for you to have some sort of an understanding so that you know where to go afterwards. And I'll pass the floor to Alexander here because he will have to leave earlier. And then it will be Stephanie, and then I'll recap the final one on my end.
Good afternoon again, everyone. So one more time, I will introduce myself. So I'm Alexander Raptsov, the Chief of Humanitarian Mining Sector in Ministry of Reintegration. So I was chairing the Breakout Room 3, which was dedicated to the newly created Mine and UXO accidents database. I highlighted how actually this system works, how the data collection works, how the data is verified, and how it is possible to get the access to this database and its visual version of a dashboard. I also introduced my colleague and our partner from Ukrainian Agricultural Council to highlight the issues of agricultural accidents and socio-economic cause of the accidents in agricultural sector. As far as I represented the statistics that we have at least 30% out of total accidents overall, they are related to agricultural accidents. So the accidents which are occurring with the farmers, with the agricultural workers on the fields or on the way to the fields or outside the fields while they are returning back home. And why it is happening and how we can reduce the accidents in specifically agricultural sector. As well as I also represented the criteria of our cooperation with the victim assistance operators, mine action operators, interested parties who want to access the data, to have the more detailed and precise data on the victims of the mine and UXO accidents. So in generally, presentation was quite dynamic and quite productive. We had some couple of questions which were related to the period of verification of each accident, how long it takes to cooperate on the scale of the local field with different departments of each local authority, each local administration. We also had a question from Ministry of Social, from the charity foundation, one of Ukrainian charity foundation, which is working closely with Ministry of Social Policy on how the data can be accessed or hand over from our database of Ministry of Integration to Ministry of Social Policy. So I appreciate again very much for Nick and for the leadership of Handicap International, for the management of Handicap International, for giving me the opportunity to share the information on the database and to share our future cooperation, the information about our future cooperation and its developments. Thank you very much, and if you have any questions to me, I'm ready to answer.
Excellent. Thank you very much. And once again, we're really happy for the Ministry of Reintegration on doing this important and a huge first step in victim assistance in Ukraine. You've done excellently, and the database looks amazing. And so I hope that the working group, which, as you have seen, one of the objectives is to support your ministry in building a national victim assistance response, will be beneficial to you. And then, of course, DRC, Humanity and Inclusion, and I'm sure a lot of other organizations as well, are always happy to support you in these endeavors. So thank you very much for your time.
Thanks a lot. Thank you for this opportunity.
Can I take this one?
Yes, excellent. Go.
Okay. Hello, everyone. I'm Steffi. I'm the Inclusion Humanitarian Action Specialist with Humanity and Inclusion. And with the group in Breakout Room 2, we were talking today about decreasing stigma of persons with disabilities, which is quite a huge task for a 2-hour session, let alone even a project. So when we are talking about decreasing stigma, we need to consider that this is one barrier persons with disabilities face, leading towards exclusion and the lack of participation within society. There are other barriers as well that we always need to take into consideration. So we are having, of course, physical inaccessibility. We are talking about lack of legislation or even the implementation of a legal framework. And we are also, of course, talking about communication barriers. So in order to really decrease stigma, we always have to keep in mind those other barriers as well. And we were talking within the group about tools, like what can we do to actually work on those barriers. And we were talking about the key principles of participation of persons with disabilities within humanitarian actions and as well humanitarian decisions that are taken. Then we were talking about empowerment as well as capacity development that is important to foster inclusion. We cannot forget data. We need to count persons with disabilities. We need to assess barriers. We need to understand what's going on in the community we're working with. And last but not least, again, we need to understand the barriers persons with disabilities face. And within the community, we need to talk and actively listen to what can be solutions to minimize these barriers. So again, when we talked about in the group of focusing on decreasing stigma, we need to ask ourselves, how do we portray persons with disabilities? How do we talk to them? How do we talk about them? What pictures are we giving out about persons with disabilities? Are we reproducing stereotypes? Are we aware of our own attitudinal barriers that we have? And we all have them. So there are also aspects that we ourselves can do in order to decrease stigma that's not necessarily leading to changing a whole program. It's being aware of attitudinal barriers. It's understanding barriers at community level. It's actively participating or talking to persons with disabilities, understanding what they want, what they need, applying a kind of, how did we say, disability rights view on disability. So being respectful, adhering to the rights-based language as well. So we are talking about persons with disabilities. We are not talking about suffering. We are not talking about impaired people. We are not talking about persons bound to wheelchair. We are using person-first language. We are focusing on abilities and not disabilities, right? And then I've been asking participants what action could they take in order to support decreasing stigma with their work. So what has been mentioned was they definitely will increase participation and consultation of persons with disabilities. They want to ensure their activities are accessible, from inclusive facilitation of an awareness-raising session, for example, to an accessible venue, to accessible materials, so meaning multi-performance, not just the written form. We were talking about that participants want to more use the rights-based language, apply respectful communication, and communicate directly with persons with disabilities. And they also want to support capacity development within their own institution, within their own agency, to increase accessibility of, for example, rehabilitation and MHPSS services. And then the takeaway of the participants was, again, we can lead by our own example. We can apply rights-based language. We need to ensure participation. We need to understand the barriers and have the projects we do context-specific. This also means that the community that we are working in, when we talk about decreasing stigma, we understand their thoughts, we understand their misconceptions, and we do work together with them in phrasing positive messages of persons with disabilities. And basically what we thought and said in the workshop was that changing stigma is connected to social transformation, which is a huge workload. But in order to take a step forward towards at least this, we need to consider all the barriers, not just the attitudes of persons with disabilities. And we can start within our organization, having persons with disabilities among staff, adapting materials, making sure everything we do is accessible for persons with disabilities, as well as having targeted interventions for persons with disabilities to ensure their independent participation. Yeah, that was basically it in a nutshell.
Quite a lot, actually. So that's wonderful, and thank you very much for taking the time. And this is something that generally is an issue, the stigma, and then the need for tackling that in Ukraine for quite some time. So thank you very much for helping our partners understand this better. I will speak a little bit about the Breakout Room 1 on financial assistance that Stephen and I led. It was a two-part breakout room. In the first portion, we had a presentation and a Q&A from the Ministry of Social Policy, and they presented the program that the state has in providing financial assistance to victims of explosive ordnance. They talked about the eligibility, about the locations, about the documentations needed for that kind of service to be received. And so it was quite a fruitful discussion and a lot of questions there for you to look at later on in the recording. And then in the second portion, we had been discussing financial assistance provided by local NGOs and international NGOs. And we tried to both hear about good practices, but also coordinate a little bit on that. And so we discussed on what is the different definitions of explosive ordnance victims, how support goes to both direct and indirect victims, how do we support families of those that have deceased, what is the difference between support to civilians and members of armed forces. We talked about the oblast that organizations prioritize for their financial assistance, and what are any other prioritization criterias, any vulnerabilities that organizations take into account on top of suffering from an explosive trauma, what documentation might be required to be eligible for such support. And then we talked a little bit also about the data protection of holding that private information of the victims. And then we then talked a little bit about how how organizations locate different beneficiaries. We made a great promotion here of the Ministry of Reintegration's platform, which is going to be a huge resource for everybody, and yourself also as sort of that potential intermediary when it comes to data protection and national legislation, which I know you're very much in tune with. And then finally, we talked a little bit about the sort of technical details of the amounts provided. What are the different coverages? What is the rationale behind the amounts? You know, if it's a one-time only, or if it goes over time. So all of these specific points, we could have used, like staff here said as well, 5 more hours or few more days to come to this. But it was a great resource to have Stephen from the cash working group and our economic recovery coordinator to really ask questions that we might not have asked so far, but there's very pertinent questions to ask, and starting to come down to good practices that we can share with the larger community on providing financial assistance. So that's it. That's it on the briefing here. I think, Alexander, you're a bit too friendly to leave. I know that you're in a rush. So.
To make anyone ashamed before cameras. Don't want to be unpolite.
Exactly, that's what I thought. Okay, that's great. Then if you don't mind, but you absolutely, I know that the ministry is really busy, so feel free. But if nothing else, we will then share the presentation, and I think I have the clicker over there. And then the final small technical detail. Da prezentacja, da. And then we will now talk about the challenges, both the ones that we expressed, you all as members of this working group expressed in the first roundtable, and then give the floor for potentially having new challenges that have emerged since. And so we will go here, exactly. And so you might see that these are all the challenges on this slide and on the previous slide that had been discussed last time. And we have then asked you after the first roundtable to prioritize those which you believe are the most pressing ones to discuss in the next roundtable. And you can see that the first four actually, in some ways have been today addressed. We might not have resolved them entirely, but we set up good conversations. Thank you very much again. Yes, likewise. And so we have, as Alexander had been showing you in the breakout room, addressed the issue that some members identified as a lack of database and referral mechanisms. We thought that might be due to the fact that within the Mine Action subcluster, organizations were quite well aware of the work of the Ministry of Reintegration, but this working group does have a lot of members that come out from other clusters. And so it was also important for us to provide a platform from the ministry to present the database that they've developed and the data that they compile on a daily basis. Secondly, and thirdly, those two were merged in Stephanie's breakout session here, and generally addressed as tackling the stigma around people with disabilities, both in terms of their inclusion in different societal elements, and then also within the communities. And then finally, we had a discussion on the financial assistance, also touching upon the need to define certain amounts of cash assistance and many other topics that were related to that as well. What is left from the previous challenges, and we'll just go through them, and then we'll give the floor for you to express any new challenge. And then yet again, in the next week, you will get a survey, and we will ask you again to prioritize the next challenges or provide feedback if you believe that the challenges discussed today had not been adequately addressed and need more attention. That's also fine. We have room and a lot of eagerness to continue tackling these challenges as well. So one of them that comes to mind, came up last time as well, was the lack of access to assistance or services for people who remain in the non-government controlled areas. And then emergency treatment of victims is an issue that we're definitely aware of. Long-term medical rehabilitation of victims is also a challenge that has been expressed last time. Lack of victim assistance related facilities or state services in the newly accessible areas, and then psychological assistance to adults and children of victims of EO, and then finally the lack of mechanisms of working with or processing confidential data and need to solve these matters with the state authorities. And so these are all still challenges on our to-do list to look at and see how we can address them. But now is the time also for both people here in person and those online to let us know if there's more challenges that you've experienced since last time, or if there's any that have not been addressed or presented here today. Somebody online, I believe there is.
Yes, hello, my name is... Yeah, do you hear me?
We do indeed, go ahead.
Okay, thank you. My name is Denis Savchenko, NGO The League of the Strong. Thank you for the event. Thank you for a fruitful discussion and recapping what has been happening in other breakout rooms. I've been present in the second room where we've been discussing the issues related to inclusion of people with disability. And I would like to stress on the fact that Stephanie was very right when she told that working and overcoming the stigma of people with disability is just one of the components of working with victims of ordnance, explosive ordnance. So my proposal is to continue discussing how we can change the system, how we can make it more barrier-free for people who receive disability as a consequence of interacting with explosive ordnance. Thank you.
Yeah, that's an excellent suggestion. Thank you very much. Consider it included in the list of challenges and things for the group to gather around and discuss and try to solve. Thank you very much. Anybody else, perhaps? There is one more online. Go for it.
Hello, I am Inna Kalashnikova. I represent the company Medicine International. I was taking part in the discussion of data collection, and I would like to express gratitude to the Ministry of Reintegration for the creation of this modern tool that would be suitable for further coordination with the ministries. And one of the areas of work in the working group, as is specified in the TR, is strengthening the support of the victims, including the provision of medical care. And so we are envisioning the following pathway. There is an incident, there is a first response, which includes transportation to the hospital, then there is a hospital aid, and there is a need of rehabilitation. So we are right now considering the parts of the second part of this process, the hospital aid and rehabilitation. I would also like to emphasize the importance of the first part of response. So yeah, of course, it's the state emergency service, it's the ambulance that is taking part in this, but we all understand how overloaded these services are and how Ukrainian society is trying to tackle the issue. There are many non-governmental organizations which are trained in providing first aid, and they are able and willing to provide such aid. But as Denis Marchuk, who has been in our room, 30% of these mine accidents they happen in the rural areas, in the agriculture, and in this case there can be up to 40 or 60 minutes for the ambulance to get to the place, and it can cost a person not just a limb but their life as well, and it only takes 10 to 15 minutes for a person to die quite often. So I represent the company Drug International, which is improving the response systems in 20 countries for over 10 years. We are providing opportunities to effectively coordinate the efforts of volunteer medical aid services and also coordinate the relations between the official services and volunteers, which we are doing through the web application and also the browser application. So it is possible to see the exact location of the incident and then track the response operations. Our platform does not require any special equipment. Every user can quickly report an incident and then the data is easily tracked. So the time is saved this way, and as it was mentioned, it takes up to 1 week to collect the data, and our platform is collecting the information automatically. And if the platform is integrated with other systems, it's then quite easy to integrate and add this to the other platforms. So we can speak to the different stakeholders, the ministries, the committees about the use of our platform with other agencies and services and non-governmental organizations. We can collect the data into the reintegration platform. So we are not discussing here the pre-hospital aid, but this indeed should be considered as one of the important stages of aiding the victims.
And thank you very much for that contribution. Indeed, emergency evacuation is something that we within the working group will focus on. So thank you very much also for the offer. That will certainly be considered. Do we have perhaps anybody else online or in person who would like to chime in? Nobody? Okay. Very well. Again, there will still be an opportunity within the week after today to send in your challenges, to prioritize the ones that we've discussed, including the new ones that will be added today. The recordings will be shared with you. All of the sort of findings or suggestions or guidelines that have been discussed within the breakout rooms. We'll try to make sort of handouts or one-page briefs so that you'll be able to share them with other organizations as well. We'll promote them through the Mine Action subcluster and its partners, and also with the related clusters that participate here. And so keep that in mind and expect an email from us with all of that information coming shortly. And then we will be organizing the next roundtable, usually within a month or a month and a half's time. So keep that in mind. Somewhere over the summer, there'll be the next one. Having said that, I would like to thank everybody who participated today, both online and in person. There was quite a lot of people actually here in person. I think about 20 and about 40 or 50 more online that have joined in from both local NGOs, international NGOs, different ministries have participated. So quite a good participation on a very important topic. And then thank you very much to Humanity and Inclusion, who co-chairs the working group with us to dedicate their resource today as well. It's a great collaboration between us and them. And of course, finally, also thank you to the Ministry of Foreign Affairs of the Netherlands for financially supporting the roundtables and the general coordination on victim assistance.